Hi, I'm Dr. Brian McElroy. I work as a GP with a special interest in the National Health Service in the UK. I wanted to make a little review of a film that I have watched twice now called Medicating Normal. In my view, it's a superb documentary that is very impactfully conveys some key messages around overprescribing of psychiatric medications and what constitutes normal and abnormal, and what constitutes a diagnosis. In my view, it's a documentary that should be viewed in all university settings by medical students, by GP trainees, by psychiatry trainees, and these are the reasons why. So firstly, if we begin with the normal aspect, so the documentary beautifully conveys how we have confused normal with comfortable, and that if we're going through a period in our lives that is intensely uncomfortable and we find ourselves behaving in ways that we normally wouldn't, then we can easily end up with a diagnosis. So the film follows 5 people with different diagnoses, such as general anxiety disorder, ADHD, depression, insomnia, post-traumatic stress disorder, and it shows how easy it is, first of all, to get a diagnosis. So for example, one of the people in the film is a veteran, and she went through an extraordinarily stressful time in a war setting. She was subsequently diagnosed with PTSD and then placed on numerous medications over a number of years. And her experience of the medication was that it made her feel worse, and then she had tremendous difficulty withdrawing from the medications. So in terms of that idea that the medications made her feel worse, so this is something that we're not taught, or it's not talked about much in medical school or in conventional mental health training. And there's a professor of sociology in the film who describes that for maybe a quarter of people who are placed on medication, they feel significantly better as a result, and they can really see that these medications help them to go through a period of intense distress. He then describes that there's maybe 40% of people who think maybe the medication was helpful, but they're not quite sure. They think maybe it had some sort of subtle effect, or they're simply not sure what effect it has had. And then there's maybe 25, 30, 35% of people who actually really don't find these medications helpful at all. But because they're prescribed the medications, they take them for a time period with the hope and expectation that things will get better, because they trust their doctors, and that's what we're kind of taught and conditioned to do, to trust doctors' knowledge. However, it's really important to acknowledge that for some people, medications do not make them feel better and can make them feel worse. And in this lady's scenario, she never felt suicidal, for example, until she started taking these medications. And this is something that I occasionally come across in general practice as well, but I feel is under-acknowledged by a certain percentage of the medical community. And sometimes people's medications are increased, or people are put on more medications despite the fact that they don't seem to be responding to a medication-based approach. The other aspect of that really struck me from this film was that rather than see people as going through a very difficult time, as kind of healthy human beings going through a difficult time and having, an experience of overwhelm or sadness or grief, psychiatrists are trained to see people through a diagnostic lens. So they're trained to spot these cluster of symptoms and equate them to a diagnosis, and then through the influence of pharmaceutical companies within medical educational settings, but also outside of the medical educational settings, doctors are often very, very quick to prescribe psychotropic medications. And the question is, where is this boundary between normal and abnormal? And Dr. Alan Francis, who was chair of the Diagnostic Statistics Manual number 4, which is where all these diagnoses come from, speaks very eloquently in the documentary that basically we've perhaps gone too far. In fact, there's no perhaps, we have gone too far, and that we're diagnosing people in a medical setting with conditions that superimpose on us a kind of obligation to prescribe and take medications, whilst really the validity of these diagnoses is very, very questionable. So I'd really encourage you to watch the film to get a more in-depth understanding of what I'm speaking about here. The other kind of take-home message from this film was that there was a number of people who described that this film is not about being anti-medication. It's not about stigmatizing people who take medication. Some people find medication helpful, but it is about raising awareness about the potential risks of taking the medications, both immediately through side effects, but also when people attempt to stop medication. Withdrawal effects can be incredibly painful, physically, mentally and emotionally, and this is conveyed really, really well in this film. You can get a sense of the intense pain and suffering that results from, number one, the the withdrawal effects themselves, which can include anything from dizziness, insomnia, intense irritability, anger outbursts, and physical symptoms such as vertigo and flu-like symptoms, and they can go on for weeks or months or perhaps even years at times. And typically in the medical community, up until recently, a lot of professionals have denied the fact of withdrawal effects. They've basically been taught and conditioned to believe that this was the person's anxiety, depression, ADHD resurfacing in the absence of medication. But you can really get a clear sense from this film that that is not the case, because some people describe new symptoms that they've never had before. And secondly, they describe distress, an intensity of distress that was far worse than even before they were placed on medications. One of the reasons I'm really passionate about speaking about this documentary is because this is something that I have seen for the last 10 to 12 years, ever since I've been interested in mental health and psychiatry, and have attended conferences where people convey these really, really awful withdrawal symptoms. And so the premise of, or the message that's conveyed very well in this documentary is that we're not, the people in the documentary aren't anti-meds, but they are pro-informed consent. And informed consent means knowing the potential risks involved in taking medications, as well as the potential of severe withdrawal effects when one attempts to stop these medications. And in all 5 cases, none of these people were warned about withdrawal effects. And from the research I've done and the research I've read, this is really consistent with what happens in the UK, Ireland, and all throughout the world. Doctors are educated a lot about when to start antidepressants or other medications, but we're not educated about how to stop, or we're not educated to warn people to stop. That withdrawal effects can occur when someone first makes the decision to take a medication. And that decision is really important, because without realizing it, you may find that you can become physiologically dependent on a medication. And if you had known that before you first took the medication, you may actually have paused before taking it and considered more options. The final point I'll make is that the film conveys incredibly well 2 things. One, the negative long-term effects of taking benzodiazepines regularly or consistently, and secondly, how the initial studies covered up the fact that these medications drastically reduce anxiety in the short term compared to placebo, but actually over the course of 4 to 8 weeks significantly increase symptoms such as panic or anxiety and a whole host of other symptoms if they're taken for over essentially 1 to 2 months. And it illustrates, because there's a lot of people who take things like benzodiazepines, Xanax, diazepam for months or years, and there is more awareness currently in the medical community, but this documentary really helped me understand why there are so many people in their 50s, 60s and 70s, and they've been on benzodiazepines at quite high doses for a number of years, for decades. I cannot speak highly enough about this film. If you're a mental health professional in particular, I highly recommend watching it. But also if you're a member of the public or a counsellor or psychotherapist, or anyone who knows someone who's taking medications or knows someone who may wish to start taking medications, it's a really good film to just give you a sense of the potential pros and cons of these different types of medications. There are a number of expert speakers interspersed throughout the film also, and it's a well-made documentary. There's a nice timing and pace to the videography and to the chopping and changing from one speaker and one person to the other. So if you see this film if you see this video before tomorrow, there's a screening of the film tomorrow. There's regular screenings of the film. You can visit Medicating Normal website, but there's a screening tomorrow, and you can find out more by the link I'll share underneath this video. So thank you for listening, and I hope you enjoy the film, and perhaps you're seeing this video after you've seen the film. So I'd really welcome any comments or feedback on how you got on when you saw the film, because I'm interested in discussing it. It's a really interesting topic for me. Thank you for watching.